deaths linked to congenital syphilis in newborns has gone up 250% in just 1 year in the Houston area. The Houston Health Department now issuing a warning for expecting moms. For more on this, we bring in Public Health Investigation Manager Lupita Thornton. Good morning to you. What are the stats when it comes to syphilis in newborns here in our area?
Good morning. Thank you for having me. Yes. Currently, we have 2018 and 2019 stats that are available, and we had 104 cases for 2018 and 149 for the 2019. We're seeing a rapid increase during this time period, and we foresee that it'll be higher for 2020 and 2021.
Can you talk to us about what the pandemic has to do with this? Why would cases be soaring?
Well, there's several reasons. There's possibility that we're starting to see an increase during this time period. We know that because of COVID-19, the laboratories have had an enormous amount of tests to report to the health department. And laboratories by law have to report positive and negative. So you can imagine how many reports were having to be sent to the health department, therefore delaying all the other reports. There were just enormous amount of lab reports. Also with the pandemic, we know that a lot of businesses closed or had minimum working hours, including our private medical providers. So we saw that seeking medical care was somewhat difficult for a lot of people.
Can you talk about how syphilis would affect a newborn? What happens when they're born?
Yes, it's unfortunate if mother goes untreated with syphilis during her pregnancy and is not treated adequately before delivery, the mom can have a miscarriage. The mother can deliver a baby that's born dead. The baby can have multiple issues, including signs and symptoms, which is an enlarged liver, blood count cells that are low, an enlarged spleen, deformed bones. These are all similar symptoms that an infant can have if born to a mother who has untreated syphilis.
Well, we know
and so the most important piece is, of course, a miscarriage or a stillbirth. Sometimes babies are born and die shortly after delivery, and some are not born alive.
Well, Lupita, obviously this is a tough conversation, but awareness and prevention are the key here. So is it going to be obvious to a mom that something's going on, that she might have syphilis? What can she do to prevent this and help protect her baby?
No, sometimes you don't know. These symptoms, syphilis symptoms come and go. And you can always think that it's various reasons why you have this rash, why you may have had the sore that's present, but then again it disappears. So then you think that it really wasn't anything. But what women need to is test before they're pregnant. You know, if they know they want to be pregnant, is test and find out their status for syphilis and HIV. Also, they need to be aware of the state statute that when you seek prenatal care, your medical provider should be testing you at your first prenatal visit, at your third trimester, and at delivery. They'll be testing you for syphilis and HIV, and of course other STDs, and you should be aware of that, and you should ask and have conversations with your provider about these tests, so that you're aware, they're aware, and if they're positive for syphilis or HIV, they should talk to their providers about their treatment plan and their medical care plan in reference to the STDs.
Thank you for your time from Houston Health Department today and for sounding this alarming bell. Good to talk to you.
Thank you.